All right, so we're going to talk about the way that I analyze my monthly charges, collections, patient balances, and any denials I get from remote therapeutic monitoring. So this is important, I think, especially in the beginning when you're starting this. Most clinics I'm working with are they're new CPT codes. They're not confident that insurance is going to reimburse, and so this is really important to gain that confidence and understanding of what's really happening with these RTM CPT codes. So we're going to go into our company file. So this is mine, right? But I've blurred out any patient information. So I'm going to go to this tab right here, and we're going to go to January, and we're going to download the RTM code report that we use to submit our, at the end of the month, right? These codes can't be produced till the month is over. So now we have to wait till the month is over. We've got this report, all of our patient names, and then the codes, these 4 codes, right? Any one in this line or 2 is to be submitted to the insurance company in that patient's plan of care because that service was provided. And so if we follow this report all the way to the bottom here, you can see that these are our total amount of each code, 98975, 98977, 98980, 98981. And then right here is our reimbursement rates. So this is Medicare reimbursement rates that are actual. And so we pulled these and we put these on each report, but you can pull them as well by going right to the Medicare physician fee schedule lookup, where you type in the 4 codes, you type in your region, and you can download this report that looks just like this. So this gives us, our non-facility reimbursement rates for each code. These are not fees. This is actual what we should receive from the insurance company, right? And so now that I have these numbers, and again, remember, we have a 15% if a PTA is involved with the 980981, just like all other CPT codes. And so we've calculated what those are, right? And now these numbers get put into this reimbursement amount. And essentially, this is really just like it's giving you information about what the rates are. So what you should be looking for when you're assessing your collections report. And then there's basically math that's going on that shows you here's what you should expect to get reimbursed for the month of January. So right here, I'm at $38,942. Now, keep in mind that normal days to receive money after so you see a patient, you submit a SOAP note today, averages between 25 and 30 days where you receive that reimbursement, that collection. With RTM, it's a little different because remember, I have to wait until the month is over. So, the patient might have discharged on the second day of the month, but I have CPT codes for RTM to submit next month. So if I submit it at the end of this month, next month, then I still have to wait 25 to 30 days to get reimbursed. So you might see a 55-day, delay from when that patient was in last until you get reimbursed for this code. So it's important to analyze this. And again, this report, so that's what we're looking at today. Here's what we should expect. Here's our rates. They're reduced by 15% for the PTA, right? And so now let me show you how I analyze this. So I've gone into my EMR system. I know what my goal is 38,942. I'm going to go into my EMR system and I run a report that looks at, it's a CPT code report. So I want to look at 98987 or 98975, 98977, 98981, and 98980. And I run a report for the month of January. So this is looking at only January. Now again, see how the service dates are not January, but this was submitted in the month of January, right? Even in my EMR, you can see that I filtered this from 1/1 to 1/31, right? So this is when we received payment essentially, which is normal. There's always a delay. So I want to look at this and I can see what I've been paid. I can see denial amounts. Is there a copay, a co-insurance, which there should be no copay at all, by the way, for RTM codes. Co-insurance, was it applied to deductible? Was there a contractual adjustment or another adjustment? And then is there a denial reason, right? So you can see codes here. So what I'm going to do is I'm going to scroll down and I'm going to just look at, I have this sorted from the highest paid amounts to the lowest. The first thing I see is, wow, these 98981s are being reimbursed much higher than what Medicare says that we should be being reimbursed, right? So that's interesting. But again, I know that this is Medicare Plus Blue, this is Priority Health. So we're also billing commercial payers. So this gives me a sense of that. So as I scroll down my list, I can see that now again, Medicare Plus Blue, so that's Medicare Plus an Advantage plan, right? Still great reimbursement, higher than what Medicare alone pays. Now we start to get into the flat Medicare. So you can see the 98981, again, still higher than what is expected. Medicare Plus Blue, Medicare Michigan. Now the 98981, remember what is our rate we're looking at? So 98981 was 32.23 if a PTA did the work, right? So we're still higher than what I would expect. So I have questions. I want to know why. Why is that? Priority Health, Medicare Plus Blue, Priority Health, Medicare Plus Blue. Again, we've got our codes are changing, right? But it's still, this is exactly what we want to see. So the 98977, right? 4244. We're seeing still a little bit higher. Again, we've got commercial payers here, Medicare Plus Blue. Okay, now it appears we get into just Medicare. All right, so 98980. Again, 98980 should be $40.37. This is being reimbursed at $37.85. So now we look at, okay, there was an adjustment here. Let's see, what is column J? J is co-insurance. So that makes sense. So we go back to our column. So they're applying $9.43 to co-insurance, which this is applied to co-insurance, but there is no co-pay. So that you have to remember that. So again, if I add that up, what is that? That'd be about, well, it's almost $10. So that'd be almost $47.85. So we'll call it, it's still higher than what we were expecting for that code. No, actually it's $47.49 right here. So that's almost exactly what we're expecting if a PT did that work, which in this case, this must have been a PT that did, and I have a hybrid. So now again, we keep coming down here, 37, 36, different code. You can see all these are co-insurance, right? Co-insurance. Okay, still, this is J is still co-insurance, so it's adding to co-insurance. 3717 plus 943, same math there. Medicare. Still we got co-insurance. Okay, now we're getting into like no co-insurance. Medicare Plus Blue. Get at this. 98977. Priority Health 98975. And again, I recommend clinics start with Medicare and Advantage plans to start with, then Medicare Advantage plans plus the secondaries, and then as things are going along, then you can start to add the commercial payers, because it's, again, as you can see, there's a lot of variability here with all these commercial plans. Medicare as a start makes it a lot easier to see what's going on. Medicare Plus Blue 98975, co-insurance 981s. So now you can see here, we're getting back to the monitoring time, 1527 for the monitoring time. There's no other adjustments. That tells me that this is a secondary. So this is getting into our secondary list of insurances. Here's Medicare again, applying to co-insurance. Again, 98980, watch lower, secondary insurance. Secondary insurance is paying. Secondary insurance is paying. Now we get into right here at the bottom of my report where all of a sudden my reimbursement amounts are zero. And I've sorted this on purpose so I can look at these individually and say, okay, what's going on here? And it's zero. There's no co-insurance. There's no applied to deductible. It's denying. It's denying. Or better yet, what's J or L? Sorry, L is a contractual adjustment. So either it's denying or it's saying that the contract does not pay, right? So they're adjusting. Where did my column go that I had? Right here. So now, okay, so we're what are we doing with that, right? So contractual adjustments, contractual adjustments. And then let's see what M is. M is other adjustment. What I don't have on here, what I'd like to be able to see is I'd also like to see applied to patient balance, right? That's something in my report that I'm going to add next time. I want to be able to see, is it adding it to the patient balance or not? And so when I have a conversation with my biller at the end of January or now, I'm going to talk mainly about this stuff here at the bottom of the report. Now, here's the reassuring part though. We add all this up. Again, these are all secondaries at the end that are giving me grief or giving me these zero. And we're going to look at those together and say, okay, what's going on? Are we most likely we're applying these to the patient balance if the secondary is not paying for it? We're applying it to the patient balance. I want to know about any denials I'm getting and why, and then resubmitting the claim if the denial is something that we've done, right? So on this report, we have some denial reasons, right? But not enough for me. So I want to dig a little deeper with my biller. But remember, my ultimate goal was to look at this and say, here's what we should be 38,942. We're at 37,494. So I'm about $1,000 off, roughly, right? However, that's not too bad. So I've got some work to do. I want to go back and I want to get paid for all the services that I provided. But it gives me a sense of, okay, we're close. We're close. We've got some things to work on. Now, that brings me to this is 1 month at a time. Very important, I think, to do this in the beginning to get a sense of, do you have an insurance, do you have a secondary that's not paying? And you don't want to send it to patient balance, so you might want to not monitor those people, right? Or just knowing that it's going to be going to patient balances so you can communicate that properly and why. But from a global perspective, here's what I look at. So I also do an AR report. And so I will look at this each month with my biller. And I separate my AR from our remote therapeutic monitoring collections, AR remaining, waiting on. I separate that out from my clinical codes to get a clearer picture. So let me show you what that report looks like. So I'm looking at, again, this is total for the year. You can even see here, this was produced on 3/5. So it's two months of the year so far. We have total due, so that's what's been submitted. This has been not currently submitted yet. What is current, meaning it's not even 30 days old yet, it's just out there, and we haven't been paid on it yet, but that's normal, right? This is where you should have a high, like current is usually high. Then we look at categories such as, is it 31 to 60 days old? Is it 61 to 90? Is it 90 to 120? Is it 120 or beyond and 151 and beyond? So obviously we want to focus on these things. Why? What is this? Is this patient balances? Is it we're resubmitting denials? Right? So we want to look at this, right? This is an important analysis that we want to do each month. So just hopefully helps you kind of analyze and gain some confidence and recognize that this I would say that the AR, when I compare this to my normal CPT code assessment, when I started out with Medicare alone, the AR looked almost exactly the same as my normal CPT codes. It was in the same flow. Like there was always some AR, but less than 10% typically would be over 90 days. As you can see here, in the CPT codes for the RTM, I'm much higher than 10%. And the reason that that is because I've also introduced commercial payers. So Medicare to me was the same AR kind of rhythm. I was less than 10% over 90 days, but there's always some AR. We're always having to adjust claims and resubmit and things. That's normal. Um, Patient balances, waiting, sending final, one, two, three final notices. But in this case, you can see my AR is much higher over, so what, 17, 20, about 30% over 90 days. The reason is that mine is like this because I have commercial payers that I'm introducing. So Blue Cross Blue Shield, Priority Health, United Healthcare, where it's slower. There's more, how would I say it? There's a lot of unique individual policies. And so learning who pays and who doesn't by submitting is what we're going through. And so that's why I recommend starting with Medicare.